All right, we can call the, very sorry for the delay, but we will call the meeting to order. Now 6:46. And do we have is there anyone on that wants to identify themselves that they will be speaking?
Hello,
Hi,
can
yes.
anyone hear me?
Oh, yes, we can hear
Oh,
you. Is that
hi,
Haley?
this is Haley from Conservation Commission, and I believe Jimmy is on with us as well.
She's.
Yeah, Haley, just to
Yes.
let you know, I can't see anyone. I can hear you, but I can't get a picture on this thing.
Oh, it's okay. We can see you on the screen, Jimmy.
Oh, okay.
Okay, so we just want to make sure we get everybody on. So Haley, could you give us some, oh, so Haley, you're from the Conservation Commission, is that right?
She's
Correct.
going to be
Great.
you're going to be public participation. Is it just you? What is your last name, Haley?
McChatton, MCHATTON, Ballou, BALLOU.
Conservation, am I correct? Is there anyone
Yep.
else on the Zoom that will be speaking during public participation?
Actually, so conservation is actually got an agenda item, so they'll be
Okay.
speaking during that. Yeah.
All right. Is there anybody here? We'll open it up to the meeting.
Oh, it's just to confirm, oh, yeah,
Nobody here.
Lorraine, are you part of the Conservation Commission item, or are you here for public comment?
She's part of it.
Oh,
She's
she's
part
part
of
of it.
yours.
Okay,
She's
great.
just gonna be.
Okay, that's okay. So it looks like everybody else here is fine, and then
Public comment, so we'll close that. And let's look approval of the minutes of our last meeting, which was January 15th. Do you have any?
I didn't have any.
Okay, let me do it,
I'll make a motion to accept the meeting minutes of January 15th as written.
and I'll accept them. All in favor?
Linehan, aye.
And Silver eye.
oh, did you guys want to do roll call? What are you gonna do?
Roll call it, it's Silva. And Linehan, and our other board member is not here this evening. She's abstained tonight. Okay, so we'll go back to the agenda and we can start with the beaver management.
Okay.
If you want to introduce yourself, Haley.
Hey there, Haley McChatton Ballou. I'm with the Conservation Commission, and we're here today to talk about the beaver management policy.
Great, thank you for coming, Haley.
And I'm Jim Lewis. I'm also here to talk about the beaver plan.
Okay, Haley.
So have you guys gotten the document and gotten a chance to look it over at all?
Hold on, I do not believe we had one. There was not one attached to our meeting. When did you send it?
Oh,
Mm.
Jimmy, do you know when Judy sent this over? I mean, it's probably happened a couple times at this point.
Yeah, I thought she was going to send it over today, but I don't know, Haley. I don't know.
Just give us 1 second. I'll take a look and see if I
Okay.
have anything here. I don't know. I think I've been missing emails.
Who would have sent the email?
Who would have sent the?
Oh no,
email?
you know what?
You got-
I found.
Judy.
Judy.
We had some backup on email. I apologize. We had some issues receiving email. Okay. So I have the document here.
Okay.
Yep.
So basically it just starts with some background on the issue and kind of why we're bringing it here. I know we've had within the past couple of months, there was an issue where an emergency order was given out and Concom kind of follows up secondary to the Board of Health. The goal of this beaver management policy is just to have a little bit more open communication and make sure that everyone kind of knows what's happening and when, and keeping record of all the different beaver related issues. That kind of sums it up. Jimmy, did you want to add to that at all?
I guess I think what we're trying to do as well is get like a checklist of items that we can go down and check as we search our, one of these beaver complaints. and I know if you've read some of the stuff from the state, they talk about taking pictures to identify the location and stuff like that, and they talk about why you shouldn't, why it's important that conservation gets involved because you can't just open these blockages up and let the water run because you drown someone down, not drown, but you can flood someone downstream or create a pond on the upstream side. So they're trying to monitor that type of stuff. And even you guys are actually you kind of set the pace with this thing because if you declare it an emergency, then all kinds of things can happen, and we would want to work together with you and maybe have you come out there with us. They recommend you coming out there with someone from your office coming out there to investigate the whole thing itself. Um, I think that's where we stand with it. Haley, you have anything else?
No, I think that's pretty much it. It's I believe it's a 4-page document.
Yeah.
Yep. Um,
Yeah.
so I guess beyond that would just be making sure that everyone's gotten to take a look at it and make sure we're not totally off base on anything. But that's pretty much it.
I think we just want to make sure we connect with you too on these things.
We do.
Yeah.
I mean, there might be things that aren't even beaver related happening out there that's causing flooding.
Yeah.
But I guess it's good to have, a few people looking at it and they want you to keep a record of this, when it happens or if it happens. So there's a little bit of bookkeeping involved with it.
Yeah,
Yeah.
so if it's fair to add, so I had a chance just to look at the memo that was sent over. I just forwarded it to the board members. I apologize, I don't know what happened. I didn't see the attachment to the email. Is it fair to summarize that a lot of the email kind of talks about like collaboration between the Board of Health and the Conservation Commission? Some of it has to do with record keeping for issuing permits for trapping beavers.
Yep.
And then also looking to kind of collaborate on if there's an incident, we would reach out to the Conservation Commission to kind of figure out when to determine when we should issue the permits. Is that a fair summary?
Yeah, I think that's a good summary.
Okay.
Yeah, it's just keeping both boards kind of communicating about cross-board issues, I guess, and also making sure that there's like history and data on it, so that way as boards change over and stuff, people can know like, oh, well, we did have a beaver-related issue in this site 2 years ago. It makes sense now that we're having this one now. It can help rule out different stormwater possibilities.
No, that's a good idea because that's something that we do currently. So the very last time, which was about a year ago, now we did reach out to engineering. So a lot of the processes that are outlined in the memo that you shared, we do reach out to engineering, reach out to DPW, make sure there's no external factors like stormwater that's causing an issue with the situation. So, but it's good to have that in writing and kind of have that process laid out. And we would be happy to reach out to conservation in the future with these kind of scenarios. So
Okay, that sounds great.
Thank you. Jimmy, did you have anything else on that we should be discussing?
I think the checklist idea is a pretty good one. I don't know if you agree with that, but we'd have to have someone put one together. I don't know if I should have our agent do it, or if you want to, then you guys can get involved in it too.
yeah,
There-
we can look at the information from the memo, and then because you guys provided a lot of information there,
Yeah.
and then we can create like a joint checklist of things that we look at
Okay.
before an order is issued.
Okay. That sounds good.
Jamie, I believe there was a draft of a spreadsheet for that checklist as well at some point.
Okay.
That'd be great if you have a draft of a checklist. If you could share that with us, that'd be great, and we can also take a look at like the statute as well, make sure that it's in compliance with what we have to enforce. But yeah, that would be great.
Okay. Good. Well, I guess I'm satisfied.
Thanks
Is there
for
anything
taking
else?
time.
Well, thank you very much for listening to us.
Of course, thank you for
Thank you.
thank you for taking the time to come to our meeting.
Okay, no problem.
Thank you very much. Have a great night.
We'll see you.
Thank you. Okay, bye.
Gary heard you.
So,
You got you. Okay, next on the agenda. That's it for you, yeah. Is there anything else? She's all done, right?
I
Okay.
think they're good.
Next on the agenda is the marijuana overlay district discussion. I believe Mr. McCarthy, if you would
Yes.
introduce yourself.
Yes,
Thank you.
My name is Matt McCarthy, attorney, law offices at 1 Center Street, right across the park. But you may recall a little more than a year ago, we a client of mine at 12, who owns 12 Peel Road, filed a petition, citizens petition, was the moving force behind the citizens petition to establish a marijuana overlay district for the sale of adult use marijuana. That went to town meeting, as you know, and was defeated. The client is going to be refiling for essentially the same thing. I know that at the last town meeting, but at that town meeting, Board of Health expressed some concerns and at a minimum wanted to be involved in discussion relating to it, and we didn't do that the last time. That was an oversight, not intentional. My purpose, well, first of all, thank you for getting this meet on the agenda tonight. The purpose, really the sole purpose today was to introduce myself, to express the desire of my client to open a dialogue. And that's was essentially the essence of my original email to the board. Anthony asked, what specifically might, we want to discuss and be willing to do. It's really, kind of open-ended. One of the things that we thought might be of some interest would be to help commit to fund any efforts of the board relating to education regarding cannabis, tobacco, or alcohol. The feeling is that could be a win-win. Obviously cannabis is legal. Its for sale is not permitted in Wakefield, or obviously anybody can go anywhere. A lot of adjacent communities to buy the cannabis. Our location offers some unique benefits. It's isolated. It's at the edge of town, surrounded by wetlands and highway and Audubon Road. So there's a lot to discuss there. I don't really intend it, no intention to get into the merits of the petition tonight, but just to say that we will be filing, the client will be filing for the upcoming town meeting. And we wanted to open that dialogue. Hopefully we can find common ground. Perhaps not, but hopefully so. And that's it. That's why I'm here.
Well, is his client's plan to operate and open the business in the same area where he presented last time?
Yes,
In the same building?
yes.
Was that ever deemed that it was a school area because we had a private school?
It wasn't. It was, so there was debate, man.
Yeah.
There was debate at the town meeting about something called the School of Rock.
Yeah.
They're closed.
The Odyssey Day School, right? The daycare there too.
I believe there's a daycare in the building. I believe there's a School of Rock and
School of Rock's to go on, but that
Right.
was a music,
Right.
school, but in any event, they go on.
Right, but there's
And
still a daycare there?
I think so.
I'm not sure if they're still there or not, but they're up, there was a daycare pre-K. I don't know what the right phraseology is, but it was like for toddlers up at the corner of Audubon and Teal. But under the state guidelines and the CMRs, that wouldn't preclude the location of the dispensary where proposed.
Wasn't part of the concern also yes, the public housing is there.
Right.
Yeah.
Not
Yeah.
quite so isolated, but there are a lot of individuals that live there.
So
And
the
some of our most vulnerable.
yeah, I mean, we know you have concerns. I'm happy to discuss each and every one tonight, but I'm really proposing an open dialogue. But the housing, the Audubon Road house is actually, even as the crow flies, at least a quarter of a mile away. I forget, I mapped it out before the last hearing. If you look at the site, and I have pictures of it, but it's at the end of Teal Road.
Yeah.
Really, it's not a location where somebody's gonna wander by. I mean, you'd have to walk 500 feet or so down Teal Road, up Audubon Road to get there. But that also, you know, there's also the fact that these dispensaries are pretty secure. And they have multi layers of security or ID checks before you can get into a sales area. But that would be our response to that, to the proximity of, you know.
But I think if we had looked back, it was the recommendation of the board, am I not correct, that we didn't feel that it was something for that area or here for the town. And I think probably Anthony will correct me if I am wrong, with the opening of other marijuana dispensaries in other cities and towns, there was a lot of promise of paying the cities or towns money. The actual commission, the person who was head of the marijuana commission actually was dismissed over a lot of things that weren't being, it wasn't
Right.
being run right, and that person was dismissed. And it's my understanding that with all this payment, a lot of cities and towns, I think, kind of adopted it because they were getting back and they felt everything would be fine. But that money was never really returned to a lot of cities and towns, and some cities and towns were actually sued that they had to pay them back. Am I not, oh, the commission? So it seems like the whole commission that's overseeing that has not really been well organized and well structured and well functioning. And it's still new, you know, in the state. And it was not only us, but it was the citizens, and it was put at a vote at town meeting and rejected. So it was the majority of people here that did not feel that that was what they would have wanted here in the town. So, Candace,
I think
any
Parker
thoughts?
has a.
Parker, you there?
If I may add, at the School of Rock, in that building, there is a school there still. I know I went to kindergarten there actually a couple of years ago. I'm in 8th grade now, and there is still a school there.
Is it like a private school?
It's a private school.
Private
I think it
school?
goes till 8th grade. It's
Okay,
like preschool to 8th.
charter type of school, or is it a Christian school, or you don't know the
No,
name?
it's like Bright Horizons. It's just a regular. I don't think it's a religious school.
I think part of the concern also is the client gonna be like a member of our community? Like, is this someone that's part of the community? Or is this someone that just wants a piece of land on the edge of our community to have their business? I think in the past, some of these smaller dispensaries. And there is, on top of that, it's almost no real community commitment from these individuals.
May I reply?
Please.
So, to your comment, and then if I may, to your comment about the funds, the people who own the building, have owned that building for, I'll say 15 years. It's been quite a while. I don't want to be with 15, but it's been quite a while. I know them personally. They operate business. Phil Clifford's Arthur. He's operated his security business out of there for that length of time. He's been there quite a while.
So it's a security business right
Yeah.
now in that building?
He runs two businesses. One's called Centennial, the other's called Dependable Security. It's really the two businesses, they provide wireless power services, you know, the dishes on. They do that type of work. They also do security, like video security, they're in contractors, consultants for that type of business. His son Michael's involved. He's a resident of Wakefield. I'm aware of absolutely no intention on their part to try. And I've talked to them about this for several years. My understanding and my belief is that they want to run this business as their own, and be an engaged member of the community. With respect to the financial commitments, not really sure what you're referring to there. I know that the money the business, the
Right.
marijuana business, sale
Right.
business, has returned a lot of money. I have statistics, but to various communities and to the state in general. Much more than, at this point than alcohol, because not that get crazy with that. But generally speaking, there's a 3% surcharge, there's 3% local tax that would come back to the community. In some communities, that's not a lot of money. Particularly where it's the only, dispensary. But and then above and beyond that, and this may be what you're referring to, there's a 3% community impact up to
Mhm,
3%
the impact,
community
correct.
impact.
Mhm.
There's been a lot of attention over the last year or two on part of the state to tying that community impact component to against some measurable metric of what is the community impact. If this would be a community impact, what we're talking about with you in terms of providing funding, so if you could enhance education. That would be my response to that. On our side, we know your concerns. We recognize, we're not saying, they're not well founded, or we're not critical at all. It's just that, from our perspective, the argument that we would make is that there's a balancing of interests, a balancing of funds, right, from your perspective. Marijuana is here. It's it's for sale in the community, can either be for legal sales or black market sales, point one. Point two, wouldn't it be better to educate about the concerns you have, which I think at the town meeting, you said, abuse of marijuana, there's studies that say it can be harmful to mental health.
Mhm.
Preventing a dispensary off Audubon Road is not going to address whether or not people use marijuana in Wakefield, right? I mean, they just go to Melrose and go wherever they go. Not going to stop anybody. But if there's real money involved that it was committed, contractually committed, legally, to the Board of Health, or to the town, and through the town to the Board of Health, to enhance, whatever educational efforts you might want to undertake, whether it's respect to cannabis or alcohol, tobacco, wouldn't that be more beneficial to the community in general than just saying, hey, we're not gonna take the money for education, and you're not gonna have a dispensary? It really, from my perspective, that doesn't make a lot of sense, because you're not stopping people in Wakefield from buying legal marijuana. And then you don't have the benefit of whatever funds might be available to educate people in Wakefield about whatever you perceive or believe to be the danger or the cautionary tale about the use of cannabis. So if you want to say no, that's fine. We hope you don't. We want to engage in the discussion. But that's your prerogative, certainly. But again, the idea was to begin a dialogue.
And in regards to the education, who would do the funding for this education? This would have to come
My
from the
client.
town?
No,
He-
fine.
He would do that, so
Yep.
he'd be paying
Yep.
the board to
Yep.
do the education?
Yep.
You'd have to run that by the legal.
Yeah, I think
Yeah,
there
it
would
has to
have to be a
be.
discussion with legal
Yeah,
counsel on
you'd
that.
have to, yeah.
Yeah, absolutely. I'm not asking you to vote on it.
Okay.
I'm just coming in to open the dialogue.
So your client is the gentleman who owns the building. He runs a business there. He's been there for about 15 years.
That's right.
They don't reside here. They reside in a neighboring community.
Liv-
Okay,
Michael lives in Linfield. Phil did live in Linfield. He lives in Gloucester.
way up there. Okay. But he wants to bring this so he will be the owner and the operator of this marijuana.
He'll be
Okay.
the principal.
He'll be the
Obviously, it'll be a
principal.
corporate entity. but
And
yeah,
his business that's there now, are they just gonna dissolve that?
they'll
or
relocate.
They'll relocate.
Yep.
Do you have any questions or? I mean, it has to, in regards to a few things here, that has to go through legal.
Yeah, I don't really feel comfortable, I think.
It's,
I feel like money to support education should come from a neutral source, or should come from like a scientific body, not be funded by a local entity who is interested in opening a cannabis dispensary here. I appreciate the offer. I think it is an olive branch, so I can understand where you're coming from. But I don't know if that's really the way that I would want to support education for our town.
And we have to check with legal in regards to.
If it's even,
accepting
yeah, if
outside.
it's even,
Yeah, if
I
it's
feel like
even
I would
legal.
rather.
Well, how about if we leave it, you know, the invitation, the invitation to dialogue is open.
Mhm.
You know,
Sure.
if you wanna
Mhm.
check with legal or, you know, let me know either way,
And when would he be doing the next petition? The next town meeting is
May 5th.
May 5th. So it would be,
The warrant is open now.
so the warrant is open, so they would be able to put their petition in and we would have to have this reopened and re-put on the agenda for,
Correct. If they get a petition in, I believe that the last day for warrant articles is March
Not
12th,
yet,
I think. So
yeah.
would that,
it's ready.
okay,
oh,
yeah,
it's
so
ready to
if they
go.
get it in before then.
So this would be something that we voted on last year, and we would have to have it brought for town meeting to be re-voted on.
I'm
So-
interested, like, what makes you expect a different outcome
Yeah.
this
And you
time?
know what, I don't really wanna get into that
Yeah,
tonight.
okay,
I'm here just to, you know, to try to open the dialogue, not here to, you know, argue the case,
okay.
before town meeting. And,
Okay.
you know, you know, it's again, it's an olive branch. It's an
I think Parker
opportunity
has to share too.
Yeah.
to discuss, you know, opportunities, but.
Parker, you want to share something? Parker's our liaison, student liaison?
Yes. So the traffic in town is already pretty bad, so opening a marijuana like store would probably add to that traffic. And also, where would the parking be? Because there's limited parking in town.
That'd be a subject, that'd be a discussion at town meeting.
Yeah, that would be discussed at town meeting.
Well, that's a
We
good,
did,
a
we
good
did
thing to
get into
consider.
that
yeah.
at the last town meeting.
Yeah,
We made a
that was-
presentation, but I don't think it's appropriate here.
Okay,
That's okay. Yeah.
Argue
okay.
the case, again, I was here to, you know, to try to open the dialogue,
Mhm.
try to work together.
Yeah, and in the future, the same thing, if you wanted to have another discussion with the board,
Yeah, we
obviously
can.
reach out, we can have, you know, an agenda item. So-
Yeah, really, what I thought was, if there was any interest, we can tell me tonight there's not, you can tell me tomorrow or whatever.
Sure.
Or if there is, that'd be great. You know, we come up with more specifics, put me on the phone. So to
and I would also like to give our third board member who
Yeah,
unfortunately is not
yeah,
here tonight. She
yeah,
was not on the board
Yeah.
when this was presented to us last year. So I would like to give her an opportunity to look
Yeah.
over everything and let us
I think that
review.
makes sense. Yeah,
Mhm.
yeah. Again, I'm not asking you to do it.
Okay,
That was it.
Thank you.
thank you.
Thank
Thank
you.
you very much.
Yeah.
Appreciate it.
Okay, health directors report.
Well, actually, oh, it's me.
Yeah.
So I wanted to take this opportunity, Parker, if you would like to do your formal introduction, you've already gotten started with the work, so you don't need much introduction, but Parker, go ahead and tell us a little about yourself.
I am serving on the youth town council. I am the liaison to the health department. I play baseball and I was just in the marching band this past fall.
Parker, what made you want to join the youth council?
I wanted to get more involved, like with the issues in this town, and yeah, mostly just that.
Great. You were very well prepared. Very well prepared.
I
Thank
know,
you very much. Yeah,
first meeting and asking
Yeah.
great questions.
right up there. That hand was
Keep
there.
it up.
That's a good sign. Well, welcome. Anytime we can do anything for you, please reach out to us. Okay.
Thank you.
Yeah,
Your
so-
health director's report.
Yep, I just want to kind of go over a couple things. So we are very excited to have a new social services coordinator join our staff. Her name is Sandra. She most recently comes to us from Haverhill. She's worked in many fields. She's worked for DCF. She's worked in long-term care. So she has a diverse background. She's a licensed social worker. She has already hit the ground running. She's been with us for about a week and a half now, almost 2 weeks, and she's already had a couple of tough cases already come up, and she's handled them very, very well. We've started to connect her with the food pantry where Jason used to hang out twice a week with them. It's been a great fit so far. She's already got a lot of experience. She's helped us out with a couple of housing cases. We've introduced her to Tracy, who used to be here in Wakefield, now is in Stoneham, just to have someone kind of be a mentor and kind of show her the ropes and make connections to people in the community that have helped us in the past. So yeah, we're very excited to have her on board, and she's gonna be a great asset. What we plan to do is our budgets are coming up. sometime in March for our department. So we will be presenting to town council coming up, and we were asked to have all of our staff, including our new staff, come and potentially just introduce ourselves to the town council again. So that would be great to kind of get more familiarity with the town, town officials and kind of get their names out there. So we plan to do that. And once our budgets are finalized before town council meeting, also bring it to the board. So you guys have a chance to look over it and have a chance to talk about it. So yeah, those are what the things that are going on right now. Erin is out on leave. Erin's our senior inspector. She's out on leave for some time. So we have been trying to fill the gaps. Dan's been doing a wonderful job, basically doing two jobs. He's been filling in with the admin job as well. So
Yeah,
yeah.
how is it? It's fun, isn't it? Come on, Dan.
Oh, it's a blast.
We have the right person in that spot.
Absolutely. Yeah, so it's kind of been all hands on deck. It's been a busy time. But yeah, hoping for better things in this new year.
Is there a status yet on the clerk's job where Cindy left? Has that been posted or anything?
That hasn't been posted yet. I don't really have any updates on that other than it's kind of an internal thing, but we
Okay.
haven't had the job posted yet.
Okay. And that's a union position, right?
That's correct.
Okay. Hopefully that will get up and going so that Dan could be relieved, at least to get back out there, because I think that our reputation with restaurant inspections has been very well. And it's
Yes.
been very on time. I know that for a fact. Very, very on time. I hear from the other side out there. Yeah, I know when you're there, when you're not there. And, I've missed you a couple of times, though, I have to say that. And I thank you for doing that. And I know Anthony hasn't been easy trying to fill two positions. I had a question on the on Erin. That grant we had for the region, did we have a health a food inspector in that one?
We did. So we have a
region.
regional inspector trainee. Her name is Shelby. She's been with us for about almost a year now. She has completed the trainee program. She's learned a lot in a very short amount of time. She's actually helped us knock out a few food inspections here in Wakefield. She's got a lot of experience now, so we're very lucky to have her on board. She covers the 6 communities that we're in this arrangement with. But she's been a great help, just doing a lot of food inspections to try and make up for that time.
And I noticed that you do have an ad for a regional public health nurse. Is that going to also come under the 6 community
That's
grant?
correct. So we have a regional public health nurse position posted with a public health excellence grant. Melrose is the fiscal agent, but this person would serve all 6 communities. Their main duties will be to help us in times of need when there's a nursing shortage. So if someone's out on leave or if the position becomes vacant, they can cover that. So they can do Maven, they can do contact tracing, they can basically do what any public health nurse can do, but they'll be kind of as a backup to the region as well.
So it's not really like a leadership role?
No,
Like an
not so
auxiliary
much,
kind of?
more of like a backup
Support,
auxiliary
like a
type
support
role.
type of thing too.
But it's also unique because Malden and Medford, I believe Medford's a VFC.
That Medford
Mal-
is, yeah,
oh,
Malden is,
Sorry, Malden's VFC.
and so is a Medford, isn't Medford
Medford
still?
might-
Medford
Medford
might
might-
have lost
yeah.
theirs, they might stop. Malden's still BFC.
Malden is a VFC, so this nurse could also help, contribute to that, can help with childhood vaccinations, can help with a variety of tasks. And then also during flu season, vaccine clinics, this person can also help with that too, so.
Anything else? you
Other
have
than
for
that,
What about CPR, I was asking about CPR. What is the story with that? Were you going to do a class on that or talk
Yes,
about choke
so,
saving? meeting?
yes, so we actually, we were looking to see if we could fund CPR training regionally. The Mystic Valley Public Health Coalition actually recently was able to fund a TIPS training regionally for alcohol service. So we invited all of our 6 communities, actually 7 communities, because that one includes Reading. Invite our 7 communities, so anybody, any business owners or any staff that wanted to come out and do their TIPS training, they were able to come out and do that. I believe we have 2 sessions coming up. But in terms of CPR, we're basically just looking for funding. We're trying to find a way to, offer it to the businesses and people of Wakefield, for CPR training, which would be great. Right now funding is a little tight and, grants are a little hard to come by, just due to federal pressures, everything going on right now. So, we are looking, trying to be creative, trying to find a way to.
We did, last time we did that a few years ago, quite a few years ago, I did it. That was a small fee to the people attending, but the instructors were all volunteer.
Yeah. Are you volunteering?
I guess I am. I guess I'm volunteering again because I've been trying to push this. My person that oversees my general, CPR instructors, we had a huge conversation about this, not to only do choke saving, but to bring in, basic CPR.
Yep.
And that should be done also. And, there is another town. In fact, I had a relative that was going to the class. They just had a class today. So I'm going to try to find out from this public health nurse exactly what they did and where she might have got her funding from.
Yeah.
A lot of time, private and ambulance companies will do it, and maybe Cataldo will give us some funding. And with all the new equipment, did you see the new ones with the laptops?
I did,
Oh,
yeah.
yeah, those are really cool.
They're
Yeah.
very cool.
I thought they were cool. They're very good. So that's it. Right.
No, I think that's a good idea. We did try to use the public health excellence grant, but unfortunately it's more of a capacity building grant. So we were allowed to do CPR training for staff and but it doesn't extend to community members. So there's some limit.
Which is what you want. You want it to be out there, especially the choke saving, a lot of, restaurants really they have to have that. So, and you want to do that right in person. I don't think I could even do CPR online. Because you have to find somebody anyways to watch you to do it. So, but I don't even like doing my instructor part on reviewing all this stuff online. Sometimes I'd rather have that little quote dummy in front of me for that little computer and I can see everything. But, and I know I did mention at the last meeting about doing more with the food inspections and being a little bit more transparent. And we thought about maybe filming, but I think that the public has to understand that right now you have Aaron out and you have Dan who is doing multi jobs. So we may have to put that on the back seat, for a little bit until we can figure that out. So it might be a spring or summer project even.
Yeah.
By then we should know something.
Yeah, we'd also talked about having the food safety training class for all of our restaurants and having, all the people in charge come and do like a basic food training. So we had that run of restaurants last year that weren't doing so well. Things have improved since, but we were talking about doing that. So, once we're back to full capacity, I think we'll start to look to do that again.
Sounds good. Do you have anything?
No, I don't think so.
I don't either. I don't have anything to add. Nothing new in the public health side.
A lot of flu, man.
Oh,
A lot of flu.
I was on Maven and I was
Lot.
blown away with the flu. And I noticed one thing, you know how I am. Anthony will tell you, I'm very into data and I do my little surveys. I'm a little stickler. And one of the things I noticed was that if people went to the hospital to be tested, hospitals were testing for flu and COVID. But if they were going to urgent care was only testing for flu. And they were all positive from the urgent care, all negative on COVID, even at the hospital. I was very surprised at that.
I've only had one patient positive for COVID in the last.
Yeah,
It's the flu, up and down.
It's really gone down. APHA with all their, the latest journals and the latest information shows that it's like down there in 10th. It's like 10th, went from 4th to 10th leading cause of death.
Yeah,
it's like
and
amazing.
A lot of people aren't vaccinated.
Yeah, so now I didn't get boosters and it's just kind of right down there. So it's different. It's just the flu. I think it's just a whole new strain and we're just gonna have to add something different next year.
Yeah.
That's all.
Yeah.
People are
We'll
miserable.
see.
Flu was the biggest. Flu was the biggest.
It is big. It is. It really is.
And we'll also get a final date. I think it's already been set, but our nurses are getting together to offer a regional camp training this year. So they're trying to be proactive this year. We're inviting all of our camps, our known camps, to come and do a training for what to expect. It's been 3 years now, so they should know. But what we're expecting them from the summer, what their binders should look like, what their protocols should look like, and what to expect when we come do inspections. So We are gonna be hosting that training. We've invited all of the camps. We are making a condition for their attendance for them to be issued a permit this year.
Cool.
So that should incentivize most of our camps to show up and listen. Obviously, we'll work with them if something comes up,
I mean, these
but
are big camps. They should be able to find
Yeah.
one representative that can,
Come on,
Yeah.
should be there,
Yeah.
a medical
not more than one.
pinpoint person too, that comes out.
and a lot of the work was already done in the last 3 years. Each year progressively, we've gotten more and more compliance. So this year, we're just really hoping to shore that up. So.
Yeah, and I don't think, there hasn't been no new camp rigs come out yet. I haven't seen them.
Not since 2020.
and no new camps this year, right? Last year we had the new sailing camp, right?
Correct, yes.
not this year.
None that we know of yet this year.
So, let's see, our next meeting would be, let me look at a calendar. Jonathan, I'm so sorry. Did you have anything, our liaison, Jonathan?
Just one quick thing to mention, we, a couple of meetings ago at the town council had talked about reviewing policies and procedures and kind of getting on an annual cadence to do that. And so I wanted to mention that only because one of the policies and procedures that sort of falls under us is actually related to liquor license policies. And one of the things that I had mentioned at that point and wanted to kind of bring up here is, you know, when and if we do look at that, I'd love to have input from the Board of Health for obvious reasons on how you guys are thinking through that. So maybe just a request that at some point in your agendas over the next couple of months, if it's something that, you know, you're interested in spending some time on and offering up some recommendations to the council, I think we'd be really open and really appreciative of that.
Actually,
thank
I'm
you.
glad you brought that up because Liz Parsons, she's our now resident expert in alcohol policy. We've had some conversations about, you know, I think it's been a few years now. We've been talking with town council trying to figure out new regulations, stuff, 1-day permits, that sort of temporary permits. So, we'd love to, you know, have a discussion here, and then maybe we can then bring
I think that would be the right
Okay.
approach. Yeah, it's been, I mean, we haven't touched that policy in 6 years that I've been on the council,
Yeah.
so it's been a while. And again, it's one thing that I want to make sure we as the town council don't do in isolation, obviously, from the Board of Health and the health department. So I think thinking about that as, you know, a conversation within the Board of Health and then kind of bringing it together with the town council after that probably is the
And alcohol regulation was brought up at one of our hearings for, excuse me, the nicotine-free generation. And someone said, you know, you're gonna do this, when are you gonna do something on alcohol? So that's interesting, and it's always been in the back.
And so what I'll do is I'll ask Liz, and then we'll put it on the next month's agenda. I'll ask Liz, we can bring some research. We'll talk about some of the policies that exist already. She's already done a lot of that work behind the
Yeah,
scenes, but
great.
yeah, so we'll have a discussion. And then maybe after budget season, then we'll give you guys a break. And then
Not like budget season, I love it.
Yeah. So they'll give us some time actually to prepare stuff, and then we can bring that
Yeah,
together.
it's one of these issues where it's not, there's not an urgent reason to look at it.
Yeah.
So we definitely want to make sure we take the time to do it right.
I think maybe we'll make the recommendation to do it after the town election, because I know you have some seats opened. So maybe right after that would be really good, because then you would have your new people on, if you have new people, and if we have new people, who knows? What will happen, and I always think that's much more fair, you know, to wait till maybe the May meeting or something like that. Just my recommendation again. I know I'm always recommending something, right?
The 19th of May. I'm sorry, March.
The 19th, wait a minute, I don't think I will be able to make the 19th. No, I cannot make it. And I cannot promise that I will have access to Zoom.
How about the 12th or the 26th?
I preferably would prefer the 26th,
That's
only because the 12th, I think, is our, we're doing a training on RSV, for public health nurse, our region, yes, doing a training thing from one of the companies. I don't know, is that okay with you?
Yep.
Is that all right? 26th? March 26th, yeah,
Works for me.
at 6:30.
6:30. We'll either be here or at the town hall.
Well, you never know, to find another place for us, maybe.
You grab in my office.
Yeah, yeah,
Around table.
Dance off.
All right, can we make a motion to
I
adjourn?
make a motion to adjourn this meeting.
And I will second that. All in favor?
And I.
Silver eye, and so moved. We will see you on March 26th. Thank you. And thank you very much, Parker. It's a pleasure to meet you.
Nice to meet you too.
Okay.
Thank you, Parker.
And thank you, Sherry. Thank
Yeah,
you for
Sherry.
troubleshooting this with us.
All right.